at the World Economic Forum 2026, where the agenda really spans from economics to geopolitical to technology. But health is increasingly central in this entire conversation. And joining me today on NDTV, we have with us Dr. Shyam Bishen. He's the Head Center for Health and Healthcare, Member Executive Committee, World Economic Forum. It's really a pleasure to speak with you on NDTV.
Thank you. Thanks so much for having me on your program.
Dr. Bishen, I think to begin with, we want to know when we talk about health and in this larger conversation, how is health being positioned this year at WEF 2026?
Yes, if you look at our agenda for WEF 2026, health comes across as central to many things. We are looking at how do we make the world a better place. We're looking at how to make the world more prosperous, how to solve for some of the human challenges that we talk about here at WEF. And if we look at our health and healthcare agenda, you'll see that it cuts across many discussions, many sectors. So I see health and healthcare being positioned as a central to many of our discussions here. Whether it's investing in people, whether it's making the world a better and prosperous place, or whether looking at global security and national security. So
I think what you said is extremely critical because health impacts each one of us, right? Just want to talk about climate change because again, it's directly impacting health. How do you think global collaboration can really bring about that change and improve public health per se from climate change?
No, climate change is a real public health emergency.
Yes.
We see the impact of extreme weather events. We see the impact of air pollution. We see the impact of global warming. Right now, close to 7 million people are dying every year just from air pollution.
Yes.
And it's only going to increase. The estimates, we have done some work with our partners, with Oliver Wyman and other partners to see what would be the impact of climate change over a period of time. We have looked at the period from now to 2050. We are looking at close to 15 million additional deaths from climate change. Mm-hmm. We are looking at a huge economic impact, which is about $12.5 trillion between now and 2050. So that is a huge number, $12.5 trillion. We need to make sure that we work with both public and private sectors so that we are preparing the health system to respond to that.
Yeah.
You know, we are doing a lot of work already on the mitigation strategies. Health and healthcare industry is responsible for about 5 to 6% of the emission, carbon emission. We need to reduce that. There is no doubt that we need to work on those mitigation strategies. But from the healthcare perspective, from the health perspective, it's also important to look at how do we come up with good adaptation strategies?
Yeah.
How do we come up with good preparedness strategies? How do we prepare the health system to respond to some of these challenges that I just talked about?
So along with mitigation, of course, what you rightly said, adaptation is very critical, right? So again, we need to deal with it, like you rightly said, public-private partnership collaboration. Talking about NCDs, which we see, whether it's diabetes, we see heart disease, it's on the rise, and that's a problem globally. How do you think the conversation here, especially when it comes to innovation, will help us deal with NCDs overall better and bring about real change on ground?
Yes, so NCD is part of our overall healthcare agenda here at the World Economic Forum annual meeting this year. We have several sessions going on that will discuss how do we respond to the growing burden of NCDs. NCDs are killing close to 41 million people every year. So 70% of the deaths of NCDs are in the low and middle income countries. So there is a huge number of people dying from NCDs, non-communicable diseases, which obviously includes diabetes, cardiometabolic diseases, cardiovascular, respiratory, and others. One of the things that we are focused on is how do we use technology?
Yeah.
How do we use AI? How do we use digital breakthrough technologies to respond to an NCD challenge? NCDs are real menace right now. They are linked to obesity. You have seen impact of GLP-1s.
Yes.
So what we are doing is we are looking at how do we use GLP-1 and other things to obviously treat for obesity, which is linked to diabetes and other things. but also looking at prevention strategies. How do we use AI? How do we use wearables like your Apple Watch and others to track and make sure that you are getting enough exercise, make sure that your blood pressure, sugar, and other things are under control. So we are looking at prevention strategies because healthcare as it stands right now is more like sick care. We know how to treat our sick people, but we don't know how to prevent people from becoming sick.
So the key here is preventive rather than curative. And I think what you rightly said, talking about health tech again, very important conversation here.
Yes.
Whether it's, using your wearables or how we can use AI, more from the preventive aspect. The other thing, Dr. Bishen, I want to talk to you about is about women's health, which often lags behind when it comes, to general healthcare as well.
Yes.
How do you think this can be brought mainstream or main global conversation or on the agenda per se?
It is on the agenda actually. So we launched a global alliance for women's health about 2 years ago together with Bill Gates Foundation. So this is something that's front and central in terms of our conversation here, in terms of our discussion here. Women spend almost 25% more of their time in sickness, in poor health. Even though people respond back to us, say that women live longer than men, so what are you talking about? But they do live longer, but the problem is that it's not a healthy lifespan.
Yeah.
So how do we answer to that? How do we look at some of the diseases that are specific to women, whether it's endometriosis, whether it's menopause, age-related, whether it's breast cancer, cervical cancer, and other things. So that's what we are looking at. How do we create more investment in that area? One of the ways to do that is looking at the economic impact. And we have worked with McKinsey and Company to look at exactly that. We launched a report about women's health about a year and a half ago, which talks about $1 trillion opportunity.
Yes.
That if we fill the women's health gap, if we take care of it, our annual GDP will go up by $1 trillion by 2040. So that's a lot of
so investing in
impact.
women's health is critical. Of course, direct impact on the economy as well.
Yes.
You did say about leading healthier lives for women, but per se, if I ask you about longevity,
Yes.
We do see people are living a longer life. But again, how do we make it for everybody globally? How can we make sure that gap is filled, that people are living healthier lives?
Yes. So I think there's been a lot of focus on longer lifespan.
Yes.
But now I think everybody realizes that you have to actually look at health span rather than lifespan. So again, to make sure that, as the world population ages, we have close to 1 billion people right now who are over 60 around the world. That's supposed to double by 2050. So bigger and bigger percentage of the global population will be 60 plus.
Yeah.
How do we make sure that these people are healthy and living a productive life, contributing to the society, contributing to their families, contributing to the national GDP growth and all of that. Again, there we have started to work with the governments, with public sector. We are also bringing private sector here to make sure that there are changes in the policies. We talked about NCDs. Older people are more prone to NCDs. How do we make sure that there are right incentives for our health system to take care of the older people? We are looking at both physical and mental health.
Yes, both are extremely important. They go hand in hand.
Absolutely.
So I think mental health is something very often we kind of skip it, but that's extremely important.
Yeah.
Lastly, Dr. Bishen, I want to ask you about financing because it still is a challenge. How can public-private partnerships or collaborations really fill in that gap to ensure that universal healthcare is accessible for all?
Yes, yeah. No, the challenge is that healthcare is very expensive. We are spending 10 to 12% of GDP on healthcare. It's growing very fast, the overall expenditure on healthcare. A lot of it is also, we are looking at it from the controlling the overall, I would say, efficiency, making it better. Right now, we waste about 20 to 25% of the healthcare money on preventable, things like diagnosis and others.
Yeah.
So we're trying to see how we can stop that, how we can move more towards outcome-based care.
Yes.
And so outcome-based care together with digital health can make the healthcare more efficient and better, more accessible. Of course, on the funding side, money is never enough. And with all the geopolitical and geoeconomic situation you see right now, there is more and more money going for military expenditure, for example. So how do we make sure that within that we continue to still make the governments realize that actually health security is national security, and you need to make sure that you don't reduce the healthcare budget. I think countries like US, Europe, even China, they are doing well in terms of their spending. Actually, in some cases, they are spending too much. For example, my home country, US, where we spend close to 20% of the GDP on healthcare. China is about 7%. India is 3.5% or
yes,
so.
I was coming to India. Right?
Yes,
yeah,
so
what
India
you say
is
about our country. Yeah.
exactly. India can do even more in terms of the overall coverage of healthcare.
Yeah.
And you talk about universal healthcare. I think India has made some good strides there, especially with their Ayushman Bharat program. On the Ayushman Bharat digital mission side, I think that's been a big help. It has brought in close to 800 million people to access health and healthcare. So India is doing a good job there, but it's still a fair way to go in terms of bringing new and breakthrough technologies, looking at innovation, accelerating it, scaling it. I think India can be a real trailblazer here. India can be real pathfinder here.
I think as a country, when the Prime Minister, Honorable Prime Minister, talks about preventive rather than curative,
exactly,
which you rightly said, the missions which we have for healthcare. But I think what you said, healthcare really is national security and it impacts the GDP. Wishing you all the really best for the next 4 days. Thank you so much for speaking with NDTV.
Thank you. Thanks.